great honor and privilege for me to be able to come. I think Indonesia is so important to the whole world. I mean, I think the first message is look after yourself. I mean, you can only help other people if you look after yourself. All our countries have more and more older people, less younger people, and if you are if you're older and you have not been healthy, then you don't have a happy old age. Do a good job. Doctors, nurses, pharmacists, physiotherapists, dietitians.
Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera bagi kita semua. Selamat datang kembali para sejawat health leaders dalam acara podcast kita Buka Mata Buka Hati, sebuah podcast bercerita tentang kepemimpinan yang inspiratif, inovatif, dan inspiratif di bidang kesehatan. Mulai dari diri sendiri untuk aktif membangun negeri. Saya Agus Rizal Hamid yang akan menjadi host dalam episode saat ini. Today, we are going to have a special guest. We know that in Singapore, there are a good transformation in healthcare. And today, a special guest, he is a Senior Vice President, Health Innovation and Translation in the National University of Singapore. He is also the Senior Advisor in National University Health System. Please welcome Prof.John Wong Eu-Li. May I call you Prof.John?
Call me John, please.
Oh, okay, Prof.John. So, thank you very much. You can come to our podcast. During your tight schedule, I know it's very hard to come, and also you can have ability to come to our country. So, how are you, Professor John, and what is your current activity now?
Well, firstly, thank you very much for having me. It's a great honor and privilege for me to be able to come. I think Indonesia is so important to the whole world, and you're so close to Singapore. I think that if we can, if we can share, our experiences with each other, it would really help both our countries so much. And so thank you very much for having me here. So what I'm currently doing is I am trying to see how I can help both the National University Health System as well as the National University of Singapore, and how I can help my own country, and how I can help ASEAN and the region, because I think if COVID taught us anything, is that if we are all healthy, all of us, our societies, our countries, will all do well. If any of us, either within our countries, if any part of society is not well, if any country is not well, we are so interlinked that it will affect everyone. So I really want to see whether I can contribute in any way. I still see patients, so that reminds me constantly when I see my patients of all there's still so much that we need to do.
Okay, so you still see your patient. How can you manage all the time between your idea and see on the patient?
Well, I'm very lucky that I've got really tremendous colleagues. So I've got doctors, nurses, pharmacists, allied health colleagues who all help me, and it's without them I could not I could not do what I currently do. So it's a real team effort. I hope that I'm able to help them also, and I hope that what we do collectively is something we all find meaningful.
Okay, so yeah, I heard that you are very experienced. I think also you wants to change the health system. You also the clinician. What makes or who it influence you to become who you are today?
I think many people. I think I'm constantly inspired by the people around me. So I'm inspired by what all of you are doing here in Indonesia. I suppose my first the first people who inspired me were my parents. My parents both believed that the best gift that they could give me was education, and so that's what my parents said. We'll give you the best possible education, and anything else is extra. My parents were doctors also, and my parents wanted to become academic doctors, but when my father graduated, my father came from a very humble background, and he was the first person in his family to go to university, and he had 8 other brothers and sisters. So he actually wanted to help put them, as many of them, through university as possible. So my father did not stay in academic medicine. He became one of Singapore's first, he went into general practice and was one of the first doctors in general practice in the western part of Singapore. And I used to go with him on house calls, and we used to visit farmers, and I was very when I saw how he was able to help patients, and he adopted an orphanage also. So my father used to look after an orphanage as well as farmers, and when I saw how the orphanage and the farmers were grateful for whatever he could do, I think that inspired me tremendously. Then in medical school, I had some quite remarkable professors. One person who continued to inspire me my whole professional career was the professor of pathology, Professor Shanmugaratnam, who was working all the way till 94. I had the privilege of first being his student, and then being his colleague, and then working with him. And I saw how he just loved his work, and he was a world expert in the 1960s when Singapore was still a struggling country. He was one of the world's experts in nasopharyngeal cancer. And he started the Singapore Cancer Registry. He started the Singapore Cancer Registry in the late 1960s. And I'm a medical oncologist. My specialty is cancer. And his registry was priceless. Without that registry, we would not have been able to really do the cancer research we do now. We would not have been able to get the data to convince the Singapore government that it's important to invest in research. So I owe a lot to Professor Shanmugaratnam. And so then I had tremendous role models when I was doing my residency training in the United States. The chairman of medicine, Professor Nachman, again, someone who was a great clinician scientist, a great clinician, a great administrator, and took a personal interest in my career. So he again was very inspiring. And then I worked with some really remarkable civil servants, Mr. Philip Yeo, who was one of Singapore's civil servants who really helped transform Singapore. So many people along, have been very inspiring.
Nice. So we have to meet the inspirational person, right? In our lifetime. So it's really a remarkable point that during the lifetime we should find the one who can really inspire us to do more in our lives. Is it?
Yes.
Yeah.
And I just realized, all the people I mentioned are men, but there have been, women who've inspired me tremendously also. And I think it's, I've been really inspired, by, I've had tremendous exposure when I was a resident. Professor Eu-Li was again a tremendous clinician, researcher, administrator who really showed me how it was how it was important to balance family with with career. Both my mother and my wife have been to be able to again balance family as well as life. And then colleagues, that I work with now, my current head of department, Professor Lee Soo-Chin, she was we've worked together from the time she was a final year medical student. Now she's head of the department, and more than half my department are women and doing incredible things.
Okay, so now we move to the success story of the National University health system. I know you are I think one of the leaders there, and to make it that story success. Before to go that, maybe you can explain a little bit a glimpse of the National University health system. What about the vision and the focus and etc. Yeah.
Well, I think the National University health system is Singapore's first academic health system. And being someone who has always worked both in academic hospitals as well as had very strong links with medical schools. So when I did my residency training, I was in New York City at Cornell Medical Center. And so there's Cornell Medical School, as well as three hospitals. The New York Hospital, which is a general hospital, tertiary general hospital. There's Memorial Sloan Kettering Cancer Center, which is one of the world's leading cancer centers. And they have a third hospital, the Hospital for Special Surgery, which is purely rheumatology, orthopedics. But they are all linked with Cornell Medical School. And actually right next door was a separate university, Rockefeller University, which did not have a medical school, but tremendous research. And I saw the interplay between research, education, and clinical excellence. And when I saw the way that people were treating their patients. And if you treat patients and if you have to teach, especially if you are teaching very, very clever people, you need to make sure that what you teach is accurate and up to date. Because we were all students, and students will always go and check to see. And especially now, it's so easy to check. So I find preparing for a lecture, I have to spend a lot of time making sure that my information is accurate and up to date. And in that way I learn. So I find that people who teach and see patients actually are extremely up to date. And then if you're exposed to research, research, especially the research that we all have to do, firstly, you have to have a hypothesis. You learn how to ask questions. You learn how to ask, why is something happening this way? Or how can I do something better? And once you start thinking about that, and if you want to try and seek funding for it, you have to compete with other people. So you need to write the best possible proposal. And to do that, you have to do all your homework. And so again, you're forced to read. You're forced to read, and you're forced to put your idea down on paper, because it's very easy to have an idea, but to convert that idea, and once you put it on paper, sometimes you see, oh, maybe the idea is not so good. And then, so that discipline of having an idea, reading up everything about it, putting the idea on paper, and then thinking of a way to test your idea. So the methodology, that discipline, and again putting it down on paper, is a very useful discipline. And then collecting the data, and then cleaning up the data and presenting the data to your peers. Your peers can tell you, we don't believe the data, or the data is missing something. And that way you learn how to collect data which is robust, can stand criticism, can stand scrutiny. And the data can either be positive data or it could be negative data. And I think negative data is just as important as positive data, because if you have done all your homework and yet the data still shows that the idea is not good, it's important to share it with people so that everyone can learn from it. So that whole exercise actually, I think, makes better doctors. Teaching, because it forces you to keep up to date. Research, because it teaches someone a certain methodology of how to take an idea, test the idea, collect data, share it, be open to criticism, learning from it. And so, and then I started reading up, and you can see that actually places which have this combination, firstly, teaching hospitals generally tend to have better outcomes than non-teaching hospitals, because everyone is forced to be up to date. And then places which combine this combination of clinical excellence fueled by education and research tend to become magnets, because everyone wants to come and learn. So you get even better people coming. So you become a magnet for people. Then you become a magnet for companies with good products, because companies with good products want to actually get you to test their products and to see whether it's really effective. And then, of course, patients always want, especially patients with difficult conditions, want to come, to these places. So you start creating a virtuous cycle based on excellence. And I think that was being someone who likes academia and someone who likes to see patients. When I saw this combination, this is when we really spoke to the Singapore government and said, we inherited the system from the United Kingdom. We were a former British colony. So the universities belong to the Ministry of Education. The hospitals belong to the Ministry of Health. But my colleagues, we're the same person. So when I teach, I would report to the Ministry of Education. When I do research, I respond, Ministry of Education. But when I saw patients, Ministry of Health. And, reporting to two ministries is always very challenging. And so we said that, we really want to be nimble, be able to adapt quickly, and to really synergize these three elements. We should try and bring everything under one governance. And that was very important, to have one governance over all three missions: clinical excellence, teaching, and research. So the Singapore government agreed to create the National University Health System. This was 2007, 2008. So it was agreed that both ministries would appoint a governing board. So the governing board will be so the appointments will be both Ministry of Health and Ministry of Education. Well, the Ministry of Education actually passed it to the National University of Singapore. So the National University of Singapore and the Ministry of Health together create a governing board. The governing board will appoint a chief executive. The chief executive reports to the governing board. And the chief executive will report also to both the president of the university as well as to the Ministry of Health. But everybody else reports to the chief executive. Okay, so not like everyone reporting to two ministries. Everyone reports to one person. That one person reports to one board, and that one person has two organizations. It was agreed that if anything, if there was any debate in Parliament, it would be the Minister of Health who responds to any questions about the health system in Parliament. So there's one minister who will respond to any parliamentary issues, but day-to-day operations, one governing board, one chief executive. But then everybody else would report to one governance. And that was a very useful way to really try and blend what we are trying to do. So we've actually moved. So besides research, education, and teaching, and looking after our patients, we want to go beyond that. And the biggest challenge now is population health. How do we keep our populations healthy? Because right now, many health systems, including the National University Health System, for the longest of times, we sit in the emergency room, we sit in our clinics, we sit in the hospitals, and patients come to see us. What we need to do is actually get out there and try and keep people from becoming patients. We need to try and do everything to keep people healthy so they don't have to come and see us. Then that would be success. And so we're spending a lot of time and effort, and I'm spending a lot of my time and effort. How do we keep the population healthy? Because we have to. All our countries have more and more older people, less younger people. And if you are if you're older and you have not been healthy, then you don't have a happy old age. And we want everyone to have a happy old age.
Yeah, before I asking about how we to jump out from our environments to see the other people's, how do you manage people in the academic situation? I mean, in the academic health system. I heard your quotes that 3 in ones and 3 in 1. So can you explain that and relate it with how we can manage people inside? Because like you said, before we go out, we have to make our strong virtue environment, and then really strong academic system in our institution.
So what we started off by saying is that all healthcare professionals want to do a good job. Doctors, nurses, pharmacists, physiotherapists, dietitians, everyone wants to do a good job. But okay, if we need people who are really good at seeing patients, we need people who are really good in teaching, and we need people who are really good in doing research. And then, of course, we need some people who are very good in administration. Okay, so we need, so let's put administration just to one side, for the time being. So if we start off by saying healthcare professionals need to be, we need all three to be important, because if any one of the three is not strong, it affects the other two. If your research is weak, you can't, you can't do all the things which are important in developing solutions for your country. If your education is weak, you can't train the next generation of professionals. And of course, if your clinical care is weak, you're not credible, and patients are harmed. So what we try and do, we ask our healthcare professionals, we want everyone, firstly, to have a threshold contribution to all three. So we need people who are healthcare professionals, doctors, nurses, pharmacists, allied health. We want them to see a certain threshold number of patients so that you can keep your skills as well as remain credible. You know what is important to teach. You know what the problems are that we need solutions for. So this threshold. But then we ask everyone, please excel in one of the three. So please be really good in any one of the three. So it's very hard to be very good in all three. So we ask people to be very good in either clinical excellence, but still threshold contribution to education and research. So threshold contribution to education, you may take a small number of students, teach a few courses which are important. Threshold research is that you may not lead research, but you contribute to clinical trials, you contribute your data to registries, you contribute your observations to colleagues who are doing research. So threshold research contributions, threshold education, but then really excelling clinically. Another person may be a superb teacher. So we say, please, again, maybe don't see so many patients. We really want you to develop curriculum. We want you to develop assessment. We want you to develop new ways of continuing professional education. That all takes time. But still continuing to see a certain number of patients so that you remain credible and still contribute to research. And the research could even be education research, which is very important. How do you develop better ways of choosing people into the profession? How do you choose better ways to mentor? How do you develop better ways to develop assessment? So that requires, again, research. And then those people who are very good in research, can you see a certain baseline number of patients? Because, let's say, my research at one stage was in drug development. Well, it's still important to see patients because I can help develop clinical trials for these patients, and still contribute to threshold education. So what we say is excel in one, but have threshold contribution in the other two. And so that's what we call the three. It's very hard for one person to do all three equally well. A few people can, but we don't expect that. We expect that you excel in one and contribute to the other two. Now, in terms of administration, we have professional, because again, administration, we have professional people who are experts in finance, in human resource, in operations. These are professional, administrators. It's really superb. These are not healthcare professionals, but they really know how to run operations. They really know how to run finance as it relates to an academic health system. But we also want some of our healthcare professionals to also be involved in administration. So, for several years, I was involved in administration, where I had to learn finance, I had to learn operations, because being a healthcare professional, I could relate with the professional administrators what was important. And so we do want some of our healthcare professionals to go into administration so that they can share what they know about how clinics run, how operating rooms run, how the emergency room runs, how it's important to have incentives so that patients actually see the primary care rather than coming to the hospital. That all requires actually experience as a healthcare professional.
Oh, nice. Really nice, the discussion about how do you manage the insight. Now, we'd like to see how do you jump out to the population, because I think now you're concerned that we have to prevent the people to come to the hospital to make them healthy. But we know that if we go out from our institution, we need more support. Example like a ministry. like a ministry, any of ministry that how do you together with the ministry, and then the ministry can support you or go together to make the other people, all outside the institution people become healthy.
Right. Well, I think it starts off by understanding, I think it starts off by understanding that firstly, getting everyone to understand the definition of health. So the WHO definition of health is a complete state of physical, mental, and social well-being. Okay? Physical, mental, and social well-being, not just the absence of disease. Okay, so if we really want a healthy population, just because someone doesn't have cancer or someone doesn't have high blood pressure or someone doesn't have diabetes does not mean they're healthy. We need physical well-being, mental well-being, and social well-being. And all three are related. I use, for instance, obesity, which is getting a big problem. You know, the incidence of obesity in Singapore is going up. But obesity is due to many factors. It's not just the food you eat. It's related to your education. It's related to the type of work that you do. It's related to your social environment. It's related even to access to public transportation. It's access to your housing environment. All of these factors actually influence obesity. So my first point is not just one ministry. It's not just the Ministry of Health. If we want healthy populations, it's actually nearly every ministry. The air we breathe, the water we drink, these all affect our health. Now, the Ministry of Health cannot control air pollution, you know. So we really need a whole of government, whole of society approach, because we need to make sure that physical, mental, and social are all equally supported. Again, using COVID as an example, you know, I mean, when you isolate people in, you know, at home and they can't go out, they can't, their mental health and their social well-being becomes affected, and then it affects their overall health. So I think this is what we've, you know, our first message in terms of population health. And everyone, you know, having a healthy population is probably our biggest asset. Any country's asset ultimately is its people. You can have all the natural resources in the world, but you know, if the population is not healthy, it's very hard to have a strong and robust country. So our people are our most priceless asset. And so we really need to address all three dimensions. And so that's what I'm working so hard, is really, it's not just the Ministry of Health. It's really, so I'm working very closely now with the Ministry of National Development, which is housing. Because in Singapore, 80% of our population live in public housing. So I really want to say, okay, how do we make sure that our townships really enable people to be healthy? And then issues of climate change. How do we affect, you know, temperatures going up in Singapore? Rainfall is increasing. You know, rainfall increasing, you have more mosquito breeding. All of these affect health. So it's really trying to work, getting all the ministries together and showing them how they improve health. You know, the data shows that, I mean, all of us eventually will die. but we don't want to die prematurely. You want to avoid premature death. You want to avoid premature disability. More than 60%, more than 60% of the factors affecting premature disability and premature death are social, environmental, behavioral. Social, environmental, behavioral. Only 10% of preventable disability and preventable death is due to the healthcare system. So, I've spent 40 years in the healthcare system, and all my efforts, if I stay working in the healthcare system, I can only shift the needle in 10%. If I want to shift the needle in 60, 70%, I need to work in the social, environmental, and behavioral areas. And that's just what I'm telling in National University Health System. If we just stay working in the healthcare system, we'll only shift the needle in 10%. We have to get out into that 60, 70%. I mean, the remaining part is genetic, but we all know again that genes are influenced by the environment. If you have an enabling environment, you can modify the phenotype, genetic expression of disease. And so that's why it's so important to move out there, and that's why it's so important to work with all the agencies, public agencies, social agencies, and the private sector. We've been fortunate that we've shown everyone the data and everyone actually sees their roles, and we're all trying to come together in Singapore to address this issue of how do we keep Singapore's population healthy for as long as possible.
Yeah, I think that's the success story. I mean, at least that you are success to ask or cooperate with the ministry. But we know behind that there are always conflicting issues. Something. How do you deal with that? Because we know sometimes when we give a discussion with any ministry, they have their own thought and they have their own idea and how to collaborate with us, and because that's where we need, because like you always mentioned that at last that we have same common goals. And how do you with your team and manage that and face that conflicting issues?
So I think we all try and start off by saying, I think everyone tries to do their best. I think everyone wants to try and do their best. So we all ask ourselves, how can we do our best for our country? So that's the starting point. How can we do our best for our country and for our people? Because at the end of the day, that's the social compact. That's the thing that keeps society together. We all want a society that is happy and healthy. And we want a country that is happy and healthy. I think I think all ministries want to do that. So if we all say that that's our goal, then I want to understand, how can I help your ministry? So how can I help your ministry? I mean, it could be information. I can share with you all the data that I know. It could be trying to help you answer questions that you find difficult to answer because you may not have the research capabilities. You may not have the access to certain experts. So how can I help you, whether you are a different ministry or a different organization? How can I help you make the whole country healthier and happier? And so trying to understand how I can help another ministry or another organization, as long as we're all trying to make the place a better place, that's usually been my starting point. And there are a lot of people who want to help. not only within our countries, but even internationally. So we all have friends, within our country, we all have friends around the world, and really trying to get people to come and help is a very powerful way to get discussions going. Because no one is expert in everything. No one is able to do everything by themselves. People can always do with additional help, additional resources. So that's how, certainly how we try and operate is how can we help other organizations? And to me, the best sign of success is when another agency or another ministry uses your idea and actually claims it as theirs. That's fantastic. That's fantastic. If someone else takes your idea and says this is the best thing ever, that's to me a sign of success. That means you've actually got someone to buy into the same vision and idea as yours. It's not who takes the credit, it's whether or not you actually get results.
Okay, yeah, nice. Now we move to for the next generation, I think, because this is one of the our goal of the podcast. Like you mentioned that you need a teamwork. A lot of people collaborate with you because what I heard from you that you have many ideas wants to work on and really wants to have the really ideal goal. It a lot how do you say it needs a lot of people. But how do you approach for the young generation that maybe collaborate with you, and how to tell them about your story, about your idea, and not really influence, but they have same thoughts and then they are the same way to collaborate with you, and maybe they will continue your works in the future.
So this is where I've been very lucky and inspired over my. We were, everyone was young or is young at some stage in their life, and when an older person takes genuine interest in your career and your development, and works with you throughout your career, it really, many of my senior colleagues, or my senior professors, they opened doors for me. They introduced me to people. They gave me advice. And it's allowed me to do the things that I currently do. So I think that now I'm 65. I've been working. I work very closely. Several of my medical students are cancer specialists, and they work with me. I refer patients to them. We co-manage patients together. So I think that if the older doctors work with the medical students, and as I tell the medical students, you are going to be my future colleague. You are going to be my future colleague. In fact, you may be my doctor when I need a doctor. So we work as colleagues, not as senior and junior, but we work as equals. We work as equals throughout our life. It's just that you have skills that I can learn from, and I have skills that I can share. But we work as colleagues. And so I've been working with, as I said, with people from the time they were medical students, and now we're working and they're teaching me and I'm sharing my knowledge. So it's a team. It's a team that starts as much as possible as everyone is everyone is equal, just that each of us have different skills. Okay, so the person teaching me to use, we just invested a lot, the Singapore government just invested a lot of money in a new electronic health record. Very, I'm having, must be the third or fourth electronic system that I've learned how to use. So the doctor teaching me how to use it, she was my medical student. She showed me a picture when she graduated as a doctor. I was the dean, and I was the one shaking her hand. She's teaching me now how to use the electronic health record. But again, I'm trying, so we work as colleagues from the very start, but we all have different skills. I taught her everything I knew about cancer medicine, and now she's a cancer specialist. And now she's teaching me, she's now teaching me how to use the electronic health record. She's teaching me some of the new and advanced drugs which she has, because she's been involved in drug development. She can share with me some of the things that she knows, and I haven't used those drugs before. So I think that's how, personally, I try and say that, whether you're old or you're young, we're all trying to do the same thing. We're all trying to prevent disease. We're all trying to help those with disease get better. We're all trying to share our knowledge, and we're all trying to create solutions. We'll all do it as a team. Whether you're young or whether you're middle-aged or whether you're older, as long as we can all contribute together as a team.
Okay. So, yeah, because every generation have their own paradigm, their own culture. For example,
but they still want to do the best. Everyone still wants to do the best that they can do.
So how do you deliver that value to them, to the young people?
Oh, that's when we see our patients in front of us, we all want to help them.
Okay. So you bring them together with you and more discussion with them to share your value and share your idea more frequently.
Well, they share their values and their ideas with me too. I do believe that everyone who enters healthcare wants to do their best and wants to help other people. Otherwise, it's so demanding. I tell people, if entering healthcare is such a demanding profession that unless you genuinely want to help people, and I think most people want to help others.
Okay, so this is the last question. What do you hope or message for the young generation, especially maybe for the medical students that going to involve with the healthcare? What is your message to young people or medical students that involved in the healthcare?
Well, I have several messages. I think the first message is look after yourself. You can only help other people if you look after yourself. So we all have to be healthy. We all have to be role models for our patients. So my biggest problem is I don't get enough sleep. And we all know how important sleep is. So I am trying my best to get 7 hours of sleep. And it's been so difficult. But I try to eat a healthy diet. I try and exercise. Even then, so I try and run at least 3 times a week. So even finding time to run 3 times a week. Again, I have to actually, I have to try and schedule that. So we all need to be good to ourselves and look after ourselves, because if we want to continue contributing and helping people, several of, as I told you, Professor Shamagaratnam worked until 94. If we want to continue contributing, we have to look after ourselves. I think the second thing is we should always remain curious and always read and learn, because it's amazing when you read and learn, you actually see ways in which you can help your patients, and it's very fulfilling learning, because you can see how you can help your patients. So always remain curious, always read, always see how you can learn to do something better. And always ask us, yourself, why is it that something can't be better? Why can't I prevent cancer? Why can't I, why does my patient have to, I cure my patient of cancer for them to die of a heart attack? That's terrible. I spend so much time curing their cancer, but they have a heart attack or they have a stroke. So how can I keep my patient well? Because that's the ultimate goal. Then why does my patient not take their medication? A lot of patients don't take their medication. So why is it that they don't take their medication? What are the reasons behind it? So really trying to always ask why and how can I do something better? And then the third message I always say is always listen to the patient. No matter how, we learn so much from our patients. So always listen to the patient. And if the patient tells you something, it's actually, sometimes the patient may not tell you verbally, but the patient may be sharing something with you which you can learn from. So I have learned, sometimes I see some very unusual side effects, or I see some very unusual reactions to medication, and my first instinct is, oh, it cannot be, because it's not reported. These side effects weren't reported, but when I actually look into it further, yes, it's a real side effect, and and this is something which hasn't been reported, and so always listen to the patients. The patients very often tell us something that we can learn from, and I'm constantly reminded of that. And I constantly tell my patients, you're right. I was wrong. and this has been so helpful. So I think that's something we always have to. So look after ourselves. Always remain curious. Always learn and meet people and read, because you never know when that can really help you in your job. And then always listen to the patients, because no matter how much you think that this cannot be, and then very often it is true.
Yeah. Okay, thank you very much, Prof.John.
No, thank you.
Very nice discussion, and I got a lot of value from you, and it boosts me also to keep up.
Again, your country is remarkable. Your country is remarkable. And I think that Singapore and the whole world can learn so much from what you are doing in Indonesia. And I think that we're all the same community, and we should all see how we can learn from each other. And yes, you do a lot of incredible and important things, and it's very important to share this with the world.
Yeah, thank you very much.
Thank you.
And also, I hope that the health leader can learn a lot, and also maybe inspire a lot, also including myself, what Professor John Wong's story of experience. Inilah podcast kita, Buka Mata, Buka Hati, sebuah podcast tentang cerita kepemimpinan yang inspiratif, inisiatif, dan inovatif di bidang kesehatan, mulai dari diri sendiri dan untuk aktif membangun negeri. Sampai ketemu kembali para teman sejawat health leaders. Wassalamualaikum warahmatullahi wabarakatuh.